my name, as we said, is Amanda Stewart. I'm a pediatric emergency medicine doctor. During my training, similar to Mia, I worked at Boston Medical Center and Boston Children's Hospital. And I actually sort of came of age as this crisis was happening. So I've been in training now for about 5 years. I started residency in 2012, right when this law was passed. Initially, this was a problem that didn't exist. We didn't see kids in the emergency room for homelessness alone. And it was something that, if it happened, was shocking. I mean, that was something that people talked about, like there were children just there for homelessness. And now it is commonplace. I mean, we see it constantly, to the point that people are expecting it. As Mia mentioned, we were both in the ER overnight last night and had 7 children in the ER just for homelessness alone. So this is something, unfortunately, that has become incredibly common. We have kids that range from weeks old to teenagers, and you can imagine the various impacts that has on those different developmental ages as well as on the families. We're now, as Mia mentioned, seeing hundreds of children in each of these institutions every year that are coming in with homelessness and really truly no medical complaints at all. Often my patients have slept in cars, as we've mentioned. They've slept on benches. They've slept in one case in a stairwell of a building before coming into us, and many of them have been denied shelter because they weren't, as you mentioned, homeless enough. And then they come to us for help. Once they're in the ER, they're often met with a very frenetic environment, potentially frightening environment. So I challenge all of you to imagine yourself as what we often see as a single parent, and often with multiple children, being sort of crammed into a single ER room and trying to keep your children calm, happy, entertained, not scared. And typically, this is for hours, but in the case of some families, unfortunately, days. And all the while, what you're hearing is the hustle and bustle of a busy ER and trying to shield your children from the injury and the sickness that's surrounding them in this emergency environment. This situation is clearly very problematic for the ER system. The beds are being utilized. Other families are waiting longer in the emergency room, waiting room. And of course, as mentioned, lots of costs to the system that do not need to be incurred. But of course, most of all is really for the families that are involved when they come to us asking for help because they don't have anywhere to go. So I just wanted to share the story of one patient that I saw that I cared for who faced many challenges related to housing insecurity. Although unfortunately stories like this are far too common, but I'll just share this one. So the patient I took care of was a teenager who had a complex medical history, particularly a heart condition that he was born with, that caused him to, at the age of 14, already have had a heart attack and open heart surgery. Unfortunately, despite this and a regular regimen of medications, his health suffered due to his housing insecurity. So he was staying with a family friend on the couch. They were unable to stay there during the day due to concerns of the family friend about her own risk of eviction for letting family members stay there that technically weren't allowed. So he and his mother would walk the streets of Boston all day, every day, until they could sort of make their way back into the home without being seen. And he came into the ER. I first met him actually when he came in for dehydration and exhaustion, and he'd actually fainted walking on the streets in the middle of the last Boston winter. At that time, he was able to go back to the home that he was staying in, and sort of some additional resources were attempted to be given, but essentially went back to the same situation. And then a few weeks later, I met him again because he came in just for homelessness, didn't have any medical complaints at that time, but was no longer allowed to stay with that family. We had lots of social workers, case managers, nurses, doctors, everybody making lots of calls to try to figure out where this patient could go, and ended up having to discharge him to a community organization where he and his mother slept on the floor in order to get documentation that they were homeless enough and had spent a night in a place not fit for human habitation. And he ended up spending, if I remember correctly, 12 days in the hospital while we were trying to sort this out, and lots of costs and lots of downsides for his family as well. So, as Mia mentioned, we know that homelessness is an adverse childhood event. We know that homeless children are at higher risk of lots of medical and psychological issues, including asthma, ADHD, depression, issues with behavior in school, as well as a lot of infections, ear infections, pneumonia, etc. So family homelessness is a very complex problem. I recognize that, and there's got to be a multifaceted solution. We want to work on diversion. We want to work on increasing access to housing, but in the meantime, we really want to prevent these families from reaching this critical point of homelessness. But at the same time, for those that aren't able to secure housing, we have to allow them access to shelter prior to spending a night in a place not fit for human habitation. I think the children of Massachusetts deserve better than being forced to sleep on the street, and the cars are in our ER.